But as I was growing up, I recognized that I really had a very good interest in biology per se. I also realized that I was a people kind of person. I really liked talking to people. I really liked helping people. And so that's how I ended up, going into medicine. Neurology per se came to me a little later in life because I did a PhD in pharmacology, and I used to spend a lot of time with these residents who are on call. So, as part of the interview process for neurology, they always ask you what kind of a, US medical experience you have, because I came from Bombay, India. And so I used to spend time with these neurology residents on call just to get clinical experience. And I was so fascinated by all of these, pathologies that walked in through the ER. And that's what really inspired me. I think these disorders are very fascinating. I'm a puzzle solver, I'm a problem solver, and I think treating patients with neurology is like solving a puzzle. Why I do what I do is because what we do really helps people get better. We try to improve the quality of life for these patients with neurological disorders. I think we have a lot of diagnostic techniques. We have a lot of good medications. We have surgical therapies, and all of these things really help improve the quality of life for patients. And nothing makes me happier than seeing a patient being, relieved of their suffering. The way we practice medicine today in 2023 is a collaborative approach. We talk to the patients about what we found, what kind of investigations we need to do. We talk to them also about cost effectiveness, if their insurance is going to pay for this. We talk to them about here are the options of different medications, pros and cons, effects and side effects, and we involve the patient and the family in the decision-making process. My philosophy is that if you make this a collaborative process, if you explain everything very nicely to the patient, they have a lot of buy-in, they adhere, they're compliant, and they respond to treatment and get better. So one of the things that I do for a living is a surgical procedure that's called deep brain stimulation, or DBS. And I started doing this from 2002 when the therapy was initially approved. The best thing about a therapy like DBS is a patient walks into your office, they're shaking, they're slow, and you work with the DBS device and you're literally able to control their tremor, especially for patients with essential tremor that have not been able to pick up a glass of water or a cup of coffee without dropping it, and you see them go from this to this. Is just so rewarding, and people start crying because they're so happy that they're better. So I think that DBS clinic is definitely one of my most rewarding clinics.